Hello, my name is Toa. I'm a student physical therapist assistant from South University, and today I'm going to be doing my mock treatment on a patient with RSD, or otherwise known as reflex sympathetic dystrophy. It can also be called CRPS, or complex regional pain syndrome. So, brief information about my patient. She is a 39-year-old female with stage 1 RSD, and this disease is very prevalent in women, affecting mainly in their mid 40s. So a little bit about this diagnosis is she is going to experience some burning pain in her arm. That's where she's experiencing it in her left arm, and she's going to have a little bit of edema. And in her case, she has a 1+ pitting edema, which if I were to push down onto her affected limb, it's going to rebound almost immediately, so it's not very bad on the edema scale. Her past medical history indicates that she has fibromyalgia, which was diagnosed 2 years ago. And her occupation, she works 50 hours a week in a photography company, which involves a lot of hand movements, like fine motor control of the hands, as well as a lot of shoulder movement. And I'm going to be going over the short-term goals that I've come up for her. So short-term goal number 1, I'm going to reduce pain with the use of modalities such as contrast bath to reduce the pain from an 8 out of 10 to a 4 out of 10, as well as having an increase in shoulder abduction to 90 degrees, so about like that. Short-term goal number 2 is to increase her muscle strength of the shoulder flexors, specifically the anterior delts, to a 5 out of 5 for functional activities such as photography and just any active daily activities that involves reaching forward or lifting up the arm. So after discussing those short-term goals, I'm going to come up with a series of therapeutic exercises or activities to help my patient gradually increase her strength, as well as decreasing the pain so that she can hopefully return to her work without any of those symptoms that are going to bother her constantly. Some of the exercises that I'm going to have her do would be mirror therapy, desensitizing the symptoms, and I'm going to have her work on fine motor control or intrinsic muscle of her hand, so that we can strengthen those muscles so that she can hopefully decrease those symptoms. And I'm going to begin my mock treatment. Hello, Jaylee. My name is Toa Nguyen, and I'm a student physical therapist assistant. And I'm going to be working with you today. And we're going to be doing a series of tests and measures, finding out where you're weak at, like where you feel pain the most. And then we're going to address your weaknesses through a series of exercises and activities so that hopefully you can get enough of strength to go back to your photography occupation.
Okay.
And before we start, if you have any pain or just discomfort anywhere, please let me know. And before we start, do I have your permission?
Yes.
Alright, so I'm just gonna briefly go over your diagnosis. I see on the chart here that you have type 1 RSD, or reflex sympathetic dystrophy. Do you have any idea?
Sort of.
Okay, so basically what type 1 is, it doesn't involve any nerve, so that's good because you won't have like a burning or radiating pain down your arm. So your left arm is injured.
Right.
And what is your pain level right now?
It's about a 2 out of 10 right now.
Okay, how would you describe your pain?
It's like a sharp pain that I feel.
Sharp. Okay, it doesn't radiate.
No.
Okay. And do you have any past medical history that I should be concerned about?
Other than fibromyalgia, no.
Okay, so what I'm going to do is I'm going to assess your muscle, the shoulder flexion strength. Alright, so I'm going to have you sit right there, and with your left arm, this one, I want you to kind of try to bring it just shoulder level, like that, okay? And can you hold that motion again? And I'm going to bring your arm down, but don't let me, okay?
Okay.
1, 2, 3, go. Okay. So you're a 3 out of 5. Next, I'm going to be assessing your sensation of your C4, C5, and C6.
Okay.
Right? So this is called a light touch sensation test, and basically I'm just testing to see if your sensation are intact.
Okay. I hope so.
All right, so I'll be using this Q-tip, and then I'm just gonna lightly touch your forehead and so that's how it's gonna feel like.
Okay.
All right. I'm gonna be doing a series of 5 trials for each area,
Okay.
and I'm gonna have you close your eyes. So just let me know if I'm touching you or not, and you just say yes or no. I also forgot to mention that I will be testing the other side as well to compare the results on the affected arm.
No. No.
Okay. Am I touching you now?
Yes.
Am I touching you now?
Yes.
C4, C5. Am I touching you now?
Yes.
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 Okay. Am I touching you now?
No.
What about now?
No.
Am I touching you now?
Yes.
Okay. Am I touching you now?
No.
Am I touching you now?
Yes.
Okay. So some of the areas you were kind of off, you couldn't differentiate if I was touching you or not when I was in fact touching you with a Q-tip. And that's normal because patients with RSD, they're going to have increased sensation. And you also have a little bit of swelling too, so that might make it more difficult to feel sensation.
Okay.
And another measure I'm going to test on you is your deep tendon reflex.
Okay.
For your bicep and the brachioradialis to see if your reflexes are intact, and they should be, right? So, find the bicep tendon. Okay, so the bicep brachii is intact. I'm gonna test your brachioradialis, okay? Okay, good. Oh, you have to?
Yeah.
Okay. Good news is both of your reflexes for both of the muscles that I just tested are intact. The first therapeutic exercise or exercise I'm gonna have you do is something called mirror therapy. So I've already gone ahead and set up the mirror. So the position that I want you to get in is just place your right hand onto the bed, and your left hand is kind of just placed between the mirror, kind of like hiding it.
Okay.
The purpose of mirror therapy is to trick your brain into thinking the motion or any movements that you're producing or making with your right hand while staring at the mirror. So the reflection is basically your left hand. And every
Okay.
time you do something with your right hand, you're gonna trick your brain into thinking the other hand will not be painful because you're not using your left hand right now.
Right.
You're hiding it.
Okay.
So
That's pretty cool.
yeah. And so the goal is to gradually reduce that limb pain that you have right now in your left arm.
Okay.
And so the first exercise I'm going to have you do is kind of use your thumb and touch every finger. Yep, kind of thumb opposition. And then you're going to do that about 10 times. And how are you feeling?
Can I go fast or no?
You kind of just go slowly. Yeah. You have any pain right now?
No, it's really cool actually.
Yeah. Okay. All right, so that was 10 times. Now, the next motion I'm gonna have you do is kind of just open your hand, then close your hand, then open it back up, then close it again. We're gonna do it about 10 times.
Okay.
And each exercise is gonna have 2 sets. You feeling okay with that?
I don't feel any pain right now.
That's good. You're kind of forgetting about your left arm right
Yeah,
now,
I
right?
really am.
And then the last exercise of the mirror therapy that I'll have you do is kind of make a fist and then kind of open up each finger one at a time. The thumb, finger, middle, ring, and then pinky. And then close it. And then you're also going to do that about 10 times as well. So just do it one time. Okay, and that is therapeutic exercise number 1. Okay, Julie, the next activity that I'm going to do to you is called desensitization. So basically what that means is I'm going to be touching you with a series of objects that have different textures. So I'll be using a cloth, a cotton pad, and then a little bit more of an abrasive object. And then after that, I will be applying pressure onto your arm.
Okay.
So I start light to heavy pressure.
Okay.
And the goal is to decrease sensitivity to just any outside stimuli.
Okay.
Okay. So I'm going to be.
Do I look
tracing-
while you're doing it?
No, you can if you want.
Okay.
Okay, so just lightly graze. How do you feel?
Feels fine.
Okay, right. And I'll do this for about a couple of times. You're still doing okay?
Mm-hmm.
Okay, next I'll move on to a cotton pad, which has a little bit more of a different texture compared to the cloth. How does that feel?
Fine.
Fine? Any increase in your symptoms?
Not really.
Okay. Alright, so next I'm going to be using something that might be a little more different compared to those two objects, so
Okay.
just let me know if you have any discomfort.
Okay.
So, is that okay?
Yeah, that's fine.
Okay. And I'll do this for about 3 minutes. Now I'm going to be applying pressure, so I'm going to, how does that feel? This is light pressure that I'm pressing onto your skin right now.
Not too bad.
Okay. Gonna go a little bit more intense. It's moderate pressure. Is that okay?
I feel a little bit of pain, but it's manageable.
Okay. And I'll reduce it to, light touch. We don't want to like aggravate your symptoms.
Okay.
Okay. And you can do this at home actually. You can do it 3 times a week, 3 minutes for each object, and you want to work your way from small to big or light to heavy.
Okay.
But nothing that exacerbates your symptoms.
Okay.
Okay, Jaylene, the next exercise I'm going to have you do is called ball squeezes. And basically, it's going to strengthen those deep muscles that you have within your hands so that, you can grab things or grip things better.
Okay.
And something useful to have since you're in a photography occupation. So I'm going to demonstrate to you what the exercise would look like. Basically, squeeze the ball as hard as you can, and then release it slowly.
Okay.
We don't want like that, okay?
Okay.
So like that, slow, controlled manner. And I want you to do about 10 times for me.
Okay.
How are you feeling? Do you have any pain? Or?
Not right now.
Okay.
Now that I'm getting close to 10, it's kind of like fatiguing, so like the pain's starting to come
Okay.
a little bit.
You can release the grip. You don't have to squeeze as hard. Yeah.
Okay.
Does that help your pain a little bit? Okay. Okay. I think that's about 10, right?
Yeah.
Okay. So you would do 3 sets of 10 or 12 reps with ball squeezes, and I want you to do about 2 or 3 times a week.
Okay.
The final activity that I'm going to have you do is something a little bit more functional, something that's close to what you'll be doing on a daily basis.
Okay.
So I know that you work with cameras a lot, so I
love
brought
photography.
in my own camera. Basically, I'm just gonna have you kind of just play with it around, kind of get your hands moving again,
Okay.
loosen up everything. And if you have pain during the activity, just let me know. Basically, I'll just have you unlock the camera lens and then kind of just play around with the camera, feel it. And then later I want you to put the camera lens back on.
Okay.
If you can do that for me.
I'll try.
Okay.
Let's look at the buttons.
Okay.
Nice camera.
How did that feel for you?
It wasn't bad actually.
Yeah.
It's kind of tough putting
Yeah.
it on and off.
The purpose of functional training is that I want to get you do something that you already have an interest on, so that you
Right.
kind of
So that
be
it
more
makes
motivated.
sense.
Yeah.
To make sense to what I do.
Yeah. Basically, you would do that like 10 minutes daily.
Okay.
Yeah. Okay, so Jaylene, we've already done a lot of exercises with you today, and now I'm just basically going to educate you about what you can do at home to reduce that edema, specifically that edema that you have right now. We want to reduce that swelling, especially when you sleep. If you don't put your arm at a certain angle, and then the next morning that you wake up, your arm is going to be very swollen. So I'm going to teach you how you can position your arm.
Okay.
So go ahead and lay on the mat for me. So if you were to sleep on your back, and we want to reduce that left arm swelling or edema, let's have you put 1 to 2 pillows, depends on how fluffy your pillows are. So we're gonna minimize that limb. We don't want it to put in a gravity dependent position or a position that you're more likely to get edema.
Okay.
So we want to kind of increase the length between the bed and your arm, so kind of like at an angle, so the fluid doesn't go up to your arm or
And then get huge.
get sausage fingers, Okay, so that was how you would position your arm to sleep on your back.
Okay.
And now I want you to lay on your right side for me. If you're going to sleep on your right side, So obviously this would be bad because your arm is like, it's drooping down, it's not elevated. So edema is gonna pull your fingers the next morning you wake up. So for comfort purpose, I'll just put a pillow and let me. So you'll need about 3 or 4 pillows. Depends on how fluffy your pillows are.
Okay.
And I'm gonna bet this one. Try to have your limb, like your fingers higher than your elbow, so it prevents the fluid from coming to your fingers, causing edema. And you can kind of place your arm to the side, or as long as the pillows don't press down.
Yep.
Yep. Basically, this is how you would position yourself if you want to sleep on your side.
Okay.
Like that, so that protects the shoulder. But we're done with your therapy exercises. I'm going to give you a home exercise program that you can do at home to strengthen your shoulder muscles, so that it can help you increase strength to return to work.
Okay.
So the first exercise I'm going to show you is going to be called shoulder flexion with the help of a pipe. You can use anything at home, like a broomstick that you can hold on to. So this position, I'm gonna have my knees bent. I'm gonna grab onto the pipe or a dowel, and then I'm gonna use my right hand to help my left hand. So I'm gonna lead with my right hand, kind of help bring it back. I want it in a controlled manner. I'm gonna hold for 5 seconds. And then I'm gonna come back up again. You can come up here or you can go all the way down. But I don't want you to go beyond pain. So stop even before you feel pain. So we're gonna do that about 10 times for 3 sets. Okay, and I don't want you to arch your back. I don't want it to be like this, or I don't want it like this. I want it like this.
Okay.
Okay. Why don't you show me? Okay, knees bend, it's good. Use your strong hand to help bring your left hand back. I'm gonna avoid, keep it back. Do you feel any pain?
No.
Okay. We're gonna hold for 5 seconds when you bring it back. Keeping the abs engaged. Okay. 3 sets of 10. You can do that every other day, like Monday, Wednesday, Friday. Okay. Alright, so the next thing that I'm gonna demonstrate to you as part of your home exercise program is something that's called contrast bath. And the purpose for that is to decrease pain or manage your symptoms like edema or swelling. And so I want you to prepare 2 buckets at home. One is gonna be filled with hot water, and then the next one is gonna be filled with ice, so cold water.
Okay.
You want to have about 40 degrees difference. So this one is about 90 degrees of hot water that I prepare, and this one is 50 degrees of cold water. First, I'm going to submerge my hand in the hot water first for about 2 to 3 minutes, depending on how long you can tolerate, but we want 2 to 3 minutes. And then after that, I'm going to submerge my hand to cold water for only a minute. And you're gonna feel a lot of sensation, like cold tingling, but that's gonna be beneficial to reduce edema. Okay? You wanna have a towel to pat dry your hands. You can stand so that it's not hard on your shoulder. So after 2 to 3 minutes, I want you to bring your hand and dip into cold water for about a minute. Okay. After that, you would tap your hand, and I want you to do about 4 rounds. So that's typically around 20 minutes or so,
Okay.
and you do it on opposite days. So before, I want you to do your shoulder flexion on Monday, Wednesday, Friday. So this you would do on Tuesday, Thursday, such and such, to kind of help with that inflammation from your exercises.
Okay.
The last exercise that I'm going to have you do as part of your home exercise program is just basic standing with bracing your shoulders. So I'm going to demonstrate for you.
Okay.
So your left hand, you're just going to brace it. And I want you to stop before you feel pain. So I don't want you to go past that. Just go like that. You can alternate too, so kind of work this arm as well. And you can hold for 5 seconds when you're up here. We're gonna do about 10 times for 3 sets. Every other day. Very good. And this is something that I want you to keep. It contains all the exercises that I've already gone over, and I have a picture right here, so it's easier to reference back.
Okay.
Okay, so that's it of the therapy session. I gave you a copy of your whole exercise program and demonstrated everything that you need to do with good form.
Right.
Okay, do you have any more questions for me?
No, I think I'm good now.
Okay, awesome. Okay.